the realtors watching our discussion here are used to seeing appraisals and inspection reports when it comes to all of this stuff. So an appraiser might call out apparent asbestos, and a lot of times they're trained enough that unlike mold where they say, you know, there's dampness in a basement or a crawl space, etc., some visible apparent growth, have an expert in to test it or determine if it's normal or not. With asbestos, they generally know. They can see some old 9x9 floor tiles in a basement or a closet and know that's probably asbestos containing material. Or they see older friable duct insulation or pipe wrap or scalloped asbestos siding. They may not be able to identify older asbestos roof tiles very easily or vermiculite insulation in an attic, right? But yeah, I know that for us inspectors, the two building materials that we tend to get most concerned about because they're friable and may have higher risk of exposure are older pipe wraps and duct insulations, especially when there's a forced air system. So a lot of times we do note that and recommend that it be dealt with, and an appraiser will see it. One thing that we come across a lot is if, you know, sometimes we see there's older asbestos duct insulation just completely covering ductwork, but more often we see just little remnants of it here and there at an end or at a joint where maybe it was harder for somebody to get to. And we know that somebody, maybe a seller in the past when it got called out and they're trying to get their home sold, they just went in, probably without any PPE, and just tore it off there and threw it in a garbage bag and, you know, not doing things correctly at all, like you said. But those are the two that we tend to get most concerned about. And I just want people to understand the difference between a friable, an easily crushed or pulverized, and a non-friable material, and the fact that most of these products we're talking about in buildings were actually non-friable, and it's usually best to just leave them undisturbed, to not break them apart, not cover over them. I know that back when, it's like with anything, you know, they discovered that asbestos is a problem, it's causing these diseases, they're very painful. Well, let's get all of it out of all these buildings. So they go into schools and hospitals, you know, massive buildings that contain a lot of people, students, patients, workers, and they're exposed all the time, you know, most of the day, every day. And they go in, they start tearing all this out, and all, you know, after a while, these people show symptoms. They're sick. And it's like, if we would have known to just leave it and cover over it or encapsulate it, you know, that would have been a better option.